How do you get screened? When should you get screened? And what symptoms should you be looking for? I'm joined this morning by Dr. Kevin Carls from Essentia Health Mid-Dakota Clinic to answer some of those questions. Good morning, doctor. Thank you for being here.
Good morning, Wayne. Thanks for having me back.
You're very, very welcome. Let's start with the most basic thing. I know we just had the story about Rachel talking to her mom and the effects that it can affect, that colorectal cancer can strike at any age almost. Yeah. What is it? And give us a little background on what you can tell us about it.
Sure. Well, colon cancer is something that starts out as a polyp. Polyp is just a tiny little growth of cells in our colon lining that starts off just growing a little abnormally just because of little genetic mutations in the cells that happen. And we all get these, and we assume most people are going to start getting them in their 40s and 50s, and these things cause no symptoms at all usually. And if left intact, some of them will at least have the potential to turn into a cancer over time.
Okay, so let me ask you this. Like having received colonoscopies, they say no polyps or removed a polyp. Just because you have a polyp does not mean you have cancer.
Exactly. The polyp itself is most often just a benign piece of tissue. Okay. You know, we go in there expecting to find them when we do colonoscopies, and the nice thing about a colonoscopy as a test is that not only is it there to detect these polyps, but also to remove them. Exactly. It's one of the few tests that we have in medicine that's able to prevent a cancer, not just detect it early.
So once it's detected, you can take care of it right then and there. There's no further procedure as far as, I mean, it'll be tested to make sure that it's benign, like you say.
Absolutely.
How big of a problem is colorectal cancer in North Dakota?
North Dakota, just like the rest of the U.S., colorectal cancer is about the third highest in incidence, and it's about the second leading cause of cancer-related death in North Dakota, just like the rest of the country. So it is a very big problem. We're getting better at preventing it, and screening tests have really brought down the incidence and the mortality rates over time, but we've still got a lot of work to do, particularly in younger age groups.
Okay, what are some of these screening options?
So the most readily available screening options that anybody can do, starting at age 45, where everybody gets screened, are things like stool testing, what we call fecal immunochemical tests, just simply looking for blood in the stool. Right. There are combinations of that with tests for DNA mutations, commonly known as Cologuard testing. Okay. The FIT test that I mentioned first is something that can be an annual test. The things like Cologuard every 3 years. And of course the gold standard that we have is colonoscopy. Now these screening tests that we have, the first two, they can be done on anybody without symptoms starting at age 45 that is considered to be at low risk of colon cancer. If any of these tests are ever found positive, colonoscopy obviously needs to follow promptly with the assumption that there is something there that needs to be dealt with. And of course, there's always the one-step option, which is going right to colonoscopy.
Okay, and you know, and for some of us that maybe have a family history, that is recommended at a certain age, and it's wise to do that every 5 to 10 years, whatever your doctor recommends, correct?
Absolutely. If you've got low risk of colon cancer, colonoscopy once every 10 years may be sufficient. If you have a family history, particularly of colon cancer or perhaps very advanced or large colon polyps, sometimes we'll recommend people will come in at age 40 or even earlier than that. And it may be that we only recommend ever going 5 years at the most between scopes.
Symptoms, is that one of the issues with colon cancer, because the symptoms are not very evident?
Yeah. Colon cancer itself may have no symptoms in people. And the general screening population we look at, 45 and up, generally we go on the assumption that they may not have polyps, or they may not have symptoms, but we need to look for those polyps anyway. It's the folks that are below the age of 50 where we really have a lot of work to do, because the incidence of cancer there has actually gone up over the last 30 years. Okay. And these are the ones where we can't simply rely on these tests, because, you know, of course, we don't assume that these people are necessarily going to have cancer, but symptoms are one of the ways that we can get to these folks before that cancer develops. We look for things like, are you having unusual belly pain? Have there been any changes in your bowel movements? Okay. Do you see blood when you go? Appetite changes, weight loss.
Okay. Colorectal Cancer Awareness Month. We're basically out of time, but Doctor, I want you to tell me one or two things that people need to remember very briefly.
Just remember, when you're in your mid-40s, age 45 and up, screening is available. It is readily, very well covered by insurance, and we recommend everybody get it. If you have symptoms, always talk to your doctor. I don't care if you're a teenager and you've got symptoms, talk to your doctor. They can get you to see me and my colleagues where we can discuss this more, consider colonoscopy if necessary, and get you some answers.
Perfect. And ladies and gentlemen, don't let the word colonoscopy scare you. It is way overblown as far as horrible it is, because it ain't that bad. Doctor, thank you so much.
I appreciate it. Thank you so much.
Appreciate your time.